Chemical peels versus CO2 laser, which do I recommend? Let's talk about what's similar between the two and what's different between the two. So both are meant to remove a certain amount of surface skin in a controlled fashion. So you remove some of the things you don't want, such as brown spots or wrinkles, and you allow fresher skin to grow in. Now, chemical peels way predated lasers, and going way back in our human history, we've always found things that we could put on our skin that's a little bit caustic, where we can remove some of the impurities and allow new skin to grow in. And lasers, medical lasers, were first introduced in the 80s, and they have continued to improve. And the laser skin resurfacing lasers that we have now are very advanced, have a lot of new technology, and I'll explain to you why that's important. So between the two, between chemical peels and laser peels, I think when you're doing a light peel, where you're just doing a little bit of resurfacing, and what you're trying to treat is not particularly bad. You don't have really deep wrinkles. You don't have really, deep, big brown spots. I think both work great. In fact, you could get light chemical peels with a lot of estheticians, and it's nice and easy and very simple. And similarly, you could get a light laser peel where you use a non-ablative laser, or even a really light CO2 laser, where it's a very easy recovery. I think when you start treating more advanced symptoms, so deep wrinkles, really deep brown spots, skin laxity, that's where CO2 laser comes out ahead. The reason for that is with chemical peels, it's very treatment user dependent. So what I mean by that is you put on, for example, an acid on the area, and you have to wait for the acid to take place. So the provider needs to be able to look very closely and see, okay, the chemical peel is getting down to the appropriate depth. Okay, now I take my basic solution to cancel it out. So this is very user dependent, and if you leave the acid on a little bit too long, you may get deeper than you want, and if you cancel it out too soon, then maybe it's not as deep as you like. So there's a little bit of variability. Whereas with the CO2 laser, the difficult part is actually choosing what settings to use. So that's why you want to go to someone who knows how to choose the right settings, and not the same settings for everybody, but the right settings for your skin type and your needs. Once you have that selected correctly, the laser is going to shoot the same every time. So it's a lot more consistent. So when it comes to good skincare, beautiful skin, and plastic surgery, we always want consistency, something that we can reproduce, so you have the same kind of resurfacing over the same treatment area. So when it comes to more aggressive, medium to advanced skin rejuvenation, CO2 is definitely my preferred treatment.